Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Well, welcome to this installment of Gateway Today. And Gateway Today is that show that talks about all things Gateway Community Health Center. I'm your host, David Kash Vasquez, coming to you from our Gateway Central Clinic, where today we highlight a very important topic in our community, diabetes. We've talked about diabetes before on this show, but we're going to take an updated look at what is going on with the disease right here in the Gateway City. First, we head over to our central clinic where we get a chance to sit down with our Chief Executive Officer, Elmo Lopez Jr., along with our Chief Medical Officer, Dr. Mary J. Cortez, to talk about Gateway Diabetes Institute and diabetes in our community. Then we head over to pharmacy to talk to one of our familiar faces on the program, Dr. Cesar Bañuelos, to talk about new medications that could improve the lifestyles of those dealing with diabetes, hypertension, and kidney disease. Finally, we get a chance to catch up with our newest pediatrician here at Gateway Community Health Center. His name is Dr. Arturo Hernandez, who will talk to us about pediatric onset or diabetes within our pediatric population. We got a jam-packed show full of information related to diabetes, so sit back, relax, kick your feet up, because another installment of Gateway Today starts now. Welcome to this installment of Gateway Today. Well, today we thought it would be important that we talk about diabetes right here in our community, and two individuals that have been a mastermind behind crafting ways to combat diabetes are our Chief Executive Officer, Elmo Lopez Jr., along with our Chief Medical Officer, Dr. Mary J. Cortez. We got a chance to sit down with them. Check it out. Well, welcome to this segment of Gateway Today, and I thought it was important that we bring on two specific individuals that have been responsible for trying to curb the problem of diabetes that we have in our community. Of course, our executive producer and our fearless leader here at Gateway Community Health Center, our CEO, Mr. Elmo Lopez Jr. has joined us, along with our Chief Medical Officer, Dr. Mary J. Cortez. We're talking about Gateway Diabetes and the Gateway Diabetes Institute specifically, Mr. Lopez. And I wanted to bring you on, sir, because I wanted to ask you about the formation of the Institute and why it was started, how it was started. Tell me a little bit about that, sir. What really inspired that move to create Gateway Diabetes Institute?
Thank you, David. Thank you for having me on your show. I got together with Dr. Cortez back in 2020, and we realized that approximately 6,000 of our patients that had diabetes that are registered with us, about 35% of that group of patients were out of control, meaning they had a A1C over 9. In that case, it's out of the normal realm and the normal metric that we would like to see. So we started talking about forming the Gateway Diabetes Institute. It's not a building, it's really management of the diabetes patient with diabetes. We look at policies, procedures, how we're taking care of that patient. We look at medication management. We look at education. There's a lot of education that we do here. We have diabetes self-management classes. We have access to all the medications that one might need to help control your diabetes. And so we wanted to kind of streamline that, put in a structure so that not only our patients would know that they're going to get the best care if they have diabetes here at Gateway, but also our providers, our doctors, our nurse practitioners. They're very well educated by us having formulated policies, procedures to follow on the care of that patient with diabetes.
And so it's a holistic approach, doctora, right, to treating diabetes. And as part of that holistic approach, you as the healthcare provider, how are we getting that what's that process look like for the patient that is diagnosed with diabetes or has uncontrolled diabetes? Right now, 12% of our population within Webb County has diabetes. How are you combating that from the medical side of things?
Yes, David. So first, in every medical visit, we try to do prevention, right? And we do screening for diabetes. Once we diagnose the patient with diabetes, we start a set of orders, right, for the patient. So you're diabetic, we're gonna start medication, or we are gonna recommend lifestyle modification first of all, and then medication. Also, a patient needs to go to the ophthalmologist or get a retinal exam that we do it here in-house. Food exam and send it to the podiatrist. It's a set of things that we do for that patient to have them in control and make sure that there's no complications from diabetes.
Uncontrolled diabetes really can lead to ultimately
Many
complications. And we've seen that anybody watching may know someone or is themselves experiencing diabetes and the ramifications that come with it. That treatment, doctora, in the time since 2020, how has it progressed? Like, how have you seen, what success have you seen through the Gateway Diabetes Institute for the patients here at Gateway?
Yeah, well, medicine is always changing, right? And like we try here at Gateway to be on top of that and up to date on the treatment for any of the diseases, and more specifically for diabetes. Long time ago, the main medication that we were using is something called sulfonylureas. It was the cheapest medication. It's something that is used, but usually we leave it as the last resource, right? For patients that cannot tolerate other medications or they cannot afford it. Now we have all the medications available for diabetes. We have it here in our pharmacy, either through the pharmacy or through the drug assistance program or through a special order. So it's a special pricing when they cannot afford it, either way. So our patients go through those treatments and they're in top of the line treatment. GLP-1s, that are the injections that have demonstrated protection against cardiovascular disease, against kidney disease. So our patients are treated on top of the line.
They're getting the best medication here at our Gateway Pharmacy. And Mr. Lopez, I want to follow up on that. You, as a person that is steering the ship, sir, and bringing in these different services, how instrumental has our pharmacy been for these Gateway Diabetes Institute patients or our diabetic patients? How instrumental is it to have the drug assistance program? How instrumental is it to have a pharmacy right in our backyard?
David, is very instrumental. First of all, I do want to say that I am a patient of Gateway. I come here, my doctor is Dr. Eduardo Garza, and I have diabetes. And I am completely in control with my diabetes because I come to Gateway. I take advantage of our pharmacy. All of my medications come from our pharmacy at discounted prices, whether you have insurance or no insurance. And that's the beauty of coming to Gateway, that we have all the services you might need. And not, I mean, as a patient with diabetes myself, I do take medications on a daily basis, but they're available here at great prices. And they're available, like Dr. Cortez says, we have whatever you might need if you have diabetes. We have GLP-1s, the Ozempics of the world, the Mounjaros of the world. But not only that, we have the metformins. If you're in control, you may not need to be losing weight as well as control your diabetes. So we have everything you might need in our pharmacy. But not only that, as a patient, sometimes diabetes will come along with high cholesterol, high blood pressure, and all of that is, we have the medications and the wherewithal to keep you in control with any of those issues you might have as a patient.
Absolutely. So that's the message today, ladies and gentlemen, is to get control or get your diabetes under control. If you have questions about diabetes or experience certain symptoms, everyone's welcome to come and find out about that Gateway Diabetes Institute. We have a holistic approach to it, from preventative measures to pharmacy to laboratory and even nutrition, counseling, education, all in one place for you to control your diabetes. For more information, of course, visit gatewaychc.com or call us 956-795-8100, and you have a professional set of people here ready to help you out and control that diabetes. Thanks for watching this installment of Gateway Today, and to our CEO and our Chief Medical Officer, we say thank you for being with us today. Well, our thanks goes out to our fearless leader, our Chief Executive Officer, Elmo Lopez Jr., and our Chief Medical Officer, Dr. Mary J. Cortez, for always pushing the needle when it comes to fighting back against diabetes right here in our community. Well, the other way that we fight against diabetes is through medications and research. And somebody that knows all too well about all of that is our pharmacist right here at Gateway Community Health Center, Dr. Cesar Bañuelos, who we got a chance to catch up with. Check it out. Well, welcome to this installment of Gateway Today. And as always, we always do our best to bring you the best when it comes to healthcare information. And always a fun guest to bring on our program is our very own pharmacist, Dr. Cesar Bañuelos, who is in the house. Brother, thank you for always being a willing participant to get away from the pharmacy and come in here, man. But, you know, we brought you onto the program before to talk medications, and we're going to do that right now. But I kind of wanted to talk about some of the things that are really impacting our city, our community, specifically hypertension, chronic kidney disease, and then, of course, diabetes. But let's start with hypertension, because obviously when we start talking about hypertension, we start talking about heart attacks, we start what leads up to, right? And the worst fatal, right? Massive heart attacks, strokes, all of these things. So, you know, as you're visiting with these patients, what is leading up to hypertension and this sort of heightened diagnosis among our population here in Laredo?
So, as you can probably guess, hypertension is one of the most common disease states that we see in healthcare. And it's also one of the most preventable risk factors for heart disease, heart failure, stroke, MIs, chronic kidney disease. So it becomes really a very necessary thing for us to really treat the hypertensive patient, to delay, or if not prevent, these illnesses from happening, or these secondary outcomes from happening. I'd like to tell you, I would love to tell you about like local data, but some of the data that we have on a national setting, there was a recent trial that was just published maybe last week that said that 79% of the patients in this particular trial had uncontrolled hypertension. From that 79%, 61% of them were not treated. And 2/3 of those patients actually were only 10 points away from the goal. The goal in the trial was 130/80, and that's what traditionally we shoot for in our patients. So if you think about it, it's about initiating the therapy. And I think that's what holds us back sometimes, is actually starting the patient early as opposed to delaying it.
So is it safe to say that the study is basically telling us, and for the viewers watching, that they're walking around and they have hypertension, they don't even know about it?
As a matter of fact, yes, that is the case.
Tell me about how you treat the hypertension itself. What are the medications that folks should be excited about or should know about when it comes to treating hypertension?
Absolutely. So, you know, here at Gateway, we're very much guideline-based oriented. You know, anytime a guideline comes out, we definitely, mull it over, we read it, we reread it, and then we apply it to our daily practice. So for example, traditional triple backbone therapy for blood pressure consists of a calcium channel blocker, an ACE or an ARB, and then a diuretic such as chlorthalidone or hydrochlorothiazide. Now, sometimes it gets complex, right? Because there's going to be patients, like if we look in the trial itself, there was people that were 30 points over. So those patients, if we think about it, one blood pressure medicine may lower your blood pressure 10 points, another one, another 10 points, another one, another 10 points. So in some instances, you might be on all three, right? Some of the cool things that we do here in our clinic is that we have medication, we have pills that have all three therapies in one. So we we lower the cost because rather than you're paying for 3 separate agents, you're going to pay for 1 pill. But your pill burden, your adherence will improve because you're taking a single pill. So definitely that's the one of the 3 things that we would do. And then the last agent that we kind of call it the breaker bar in the sense is the spironolactone or the plenarone, because if you're still high, you are considered to have what's called treatment-resistant hypertension, and you need basically something really strong to get that blood pressure down, and that would be the 4th line agent that we could consider using.
I want to continue this conversation because we definitely got to talk about CKD, chronic kidney disease. We got to talk about diabetes, and then we got to talk about GLP-1s. So more with Dr. Bañuelos right here on Gateway Today. Stay close.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Well, welcome back to Gateway Today. Before the break, we were talking to Dr. Cesar Bañuelos about important medications that combat not only diabetes, but hypertension and kidney disease as well. We continue with that conversation right here, right now on Gateway Today. Check it out. Well, welcome back to this installment of Gateway Today. Well, before the break, we were joined by our pharmacist and physician's assistant, Dr. Cesar Bañuelos. On the program, we were talking about hypertension. We were talking about visiting your primary care physician or provider to make sure that obviously you get your blood pressure in check, because obviously hypertension here along the border, Dr. Bañuelos, you of all people know that it's a huge problem. Right. You mentioned that, the numbers nationwide are alarming, but I think Laredo, based on our 2023 community health needs assessment, it showed that Laredo is actually surpassing the national average in hypertension.
There you go.
Among other things, diabetes, which we'll touch on here in a little bit. But let's talk about CKD, chronic kidney disease, because so tell me about CKD. CKD is an issue or a diagnosis that folks will sort of develop, right, through certain diagnosis. How does this happen?
So usually we think about hypertension, diabetes as particular disease states that lead to chronic kidney disease. And so you start, that's why you do routine labs to check what your creatinine is, or to check what your microalbumin creatinine ratio is. And so if you start to see protein in the urine, that's one of the early signs that you're starting to have kidney failure or kidney disease more so, because proteins shouldn't be in the urine in such large amounts, for example. So anything greater than 30 milligrams per gram is basically considered to be a higher number. We call that microalbuminuria. And so when you start to see that, we need to start doing something about it.
As always, man, I appreciate your insight, because it really sheds light on some important topics that we want to hammer home to our viewers and to everybody watching. Obviously, the first is to make sure you visit your provider, your physician, to get that appointment set up, whether it's with Gateway or with anyone else, but get a baseline and find out where you're at with your blood pressure, because you could be walking around with hypertension and not even know it. And then obviously come and find out about those medications that we can provide for you here at our pharmacy. And just one little point, one more point about our pharmacy. Doesn't matter where patients go, right? Like, we deliver in-house to any which one of our clinics, right?
Absolutely. So we'll deliver to the West Clinic, we'll deliver to Shiloh, we'll deliver to pretty any pharmacy. I mean, any clinic that we have here, we will deliver. So if you want to get
including Zapata and Haverhill.
Absolutely, yeah. Zapata and Haverhill, absolutely.
Awesome. Well, you heard it from our very own pharmacist himself. If you need medications, you need a pharmacy, whether it's our central pharmacy or south pharmacy, or to get it delivered within our clinics, you can get it right here at Gateway Community Health Center. He is our pharmacist and also our physician's assistant here at Gateway Community Health Center. His name is Dr. Cesar Bañuelos, on the program right here on Gateway Today. Doc, thank you so much.
Thanks, Dick.
Hey, our thanks goes out to Dr. Cesar Bañuelos for giving us the latest and greatest when it comes to medications that help our patients treat diabetes, hypertension, and kidney disease right here at Gateway Community Health Center. That said, we're headed over to North Clinic to catch up with our pediatrician, Dr. Arturo Hernandez, who has important information to share around pediatric onset or diabetes within our pediatric population. Check it out. Well, welcome to this installment of Gateway. Today we are at our North Clinic and we wanted to visit our newest pediatrician here in the Gateway City, Dr. Arturo Hernandez, who is joining us on the program. And I wanted to talk about obesity, doc, pediatric onset or childhood diabetes, right? But really, I wanted to ask you before we got into the whole conversation, as you're sort of immersing and seeing more of these patients here at our clinics, what are you seeing in terms of pediatrics when it's regarding those types of issues?
Right. Well, when we talk about obesity, we do know for a fact that about 20% of children, this is, from 0 to 19 years old, 20% of the overall population is obese, which is an alarming number. If you really think about it, that's 1 in 5.
Yeah.
But when you start talking about our population, especially like here along the border, right? Brown and black families, that number goes up to almost 30%, right? Because 25% of the Hispanic population will have obesity. And when you look at the black population, it's about 16%. So on average, it's about a third of our black and brown people, kids will have
and
obesity.
it's such a scary number because we start thinking, right, I know a lot of our viewers, we start thinking about our kids immediately. Our brain is rushing, and so is mine as you're giving me these numbers. What is that contributor? Like, what is creating this problem among our young people?
Yeah, well, it's multifactorial. Studies have come out that genetics is a big one. So genetic predisposition, medications that we use, especially in mental health, can contribute to increases in weight, and then really our economic status, right? We know for a fact that for those of us that are on SNAP benefits and other kinds of help, food's expensive.
Yeah.
Food's expensive, and so sometimes we'll end up choosing a cheaper option that may not be as healthy, but is filling, but contributes to the overall increase in weight in our children.
Yeah, and that's the thing I think that a lot of people are immediately going to run to is that, it's the diet, it's what we're eating, it's what our kids are eating. And a large portion of it is, in fact, that we're eating not good food.
Yeah.
Because it's very inexpensive. It's cheaper to eat bad food.
Yeah.
And so I guess that's what you're seeing a lot of as you're meeting with these different patients.
Yeah, and our lifestyle too, it's very fast paced. And so it's really hard to fit a home cooked meal, right? I remember growing up, and my grandmother watching us, we always had a home cooked meal, but grandmother was there, right? Nowadays we have, households where both parents work, right? Yeah. And so it's a lot easier, to swing by, the drive-through window and pick up something that's not as healthy, that's full of, preservatives and fat, a lot of stuff that's fried. And so, yeah, there's one thing to say about what we're eating and how much we're eating, but then there's also the downside of we're not putting time into exercise and to be active and do the work. So there is a balance between what we're eating and what we're taking in as energy sources and burning up some of that energy. And so I think it's, like I said, it's multifactorial. It's genetics, it's, calorie intake, and then not having the ability to work out. And so for me, I believe that, we're in this fight together. It's not like me just giving you a prescription or me telling you what to do. I want to see what your kid's doing. I'm really invested in making sure that your child gets healthy and that by the time you leave, my practice, my office, and go see the adult providers, I hopefully have provided, you with the best health possible without having all those complications.
Well, I know just by hearing you say that, Doc, it's a breath of fresh air, because we do need our parents to stay involved in their kids' lives. Not just our pediatrician, but we need the parents to step up. It's a community effort. It takes a village, as they say, and you're living up to that analogy, right? And so finally, Doc, I guess just to clarify, right, for everybody watching, if it's not medication, if it's not surgery, it's going to come down to us making sure that we're living the correct lifestyle, right? Exercise and diet at the end of the day, right?
Yeah, I mean, that's still the mainstay, of the treatment. When you come in, we talk about, there's two words that I love to talk about when our kiddos come in who are overweight and obese. And those two words are quantity and quality, right? Quality of food is just like I mentioned. Are we picking up our food at the drive-thru window? Or are we taking time to really make, good choices and make our meals at home, where we know what the ingredients are. So that's quality, right? And then the other word is quantity. So many times we see kiddos, that are just eating way too much. The amount of calories that they're taking in versus the amount of calories that they're using, there's not a good balance there. And so those two words are probably the most important things that I can, reiterate to our parents. And then of course that third one's going to be activity. You want your kids to be active. They need to be doing, an hour of exercise every day outside of what they're doing at school, because we know that the school exercise just isn't enough.
Right. Well, like I said, it's a breath of fresh air to hear you speak about pediatrics and, again, provide that quality healthcare for our patients. And so everybody, he's our new pediatrician here at our North Clinic. If you're having questions about childhood obesity, type 2 within and even type 1, Dr. Hernandez, definitely the professional you want to come and visit. He's our pediatrician here at our North Clinic, Dr. Arturo Hernandez, right here on Gateway Today. Doc, thank you so much for your time.
Thank you, Kash.
Well, our thanks goes out to Dr. Arturo Hernandez, our pediatrician over at our North Clinic, for sharing some really important information when it comes to onset within our pediatric population. And if you need more information on diabetes within pediatrics or any of the other topics that we covered here on the program, make sure you get over to gatewaychc.com to become a patient or set up an appointment to visit with any one of our physicians or providers right here at Gateway Community Health Center. As always, if you want to catch a full rewind of this episode or any of our other episodes, make sure you head over to our YouTube channel, search Gateway Community Health Center, and don't forget to smash that subscribe button. Remember, Gateway Community Health Center is open to everyone, whether you have insurance or don't have insurance. Everyone is welcome here at Gateway Community Health Center. Till next time, we thank you for watching this installment of Gateway Today, and remember, your health is your wealth, so take care of it.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.